Australians have a 1 in 2 chance of needing to go to the ICU. Luckily, most patients will survive. Life-threatening sickness can leave an ICU survivor saddened and worried, with mobility problems, forgetfulness, difficulty working, driving a car, and doing day-to-day activities. Currently in Australia, there is no model of care to assist ICU survivors return to usual life. Our research team will soon start testing a newly developed program called Restore ICU. This 12-week physiotherapist-led program will commence on the hospital ward. Once discharged, ICU survivors will be visited at home and then transitioned to telehealth. Restore ICU promotes self-management using exercise and principles from psychology to enhance mental and physical recovery. Our goal is to see ICU survivors experiencing a fulfilling life.